Hi class, welcome. Today we are focusing on Curry, 5th edition, chapter 2, which is called Knobology. Knobology has to do with the buttons on the machine or the knobs. The chapter starts on page 33, and we're going to talk about the alphanumeric keyboard. It says the alphanumeric keyboard controls allow the sonographer to enter the patient's name, ID number, and full screen annotation. Although some software programs like WorkList will enter patient data automatically. So when you're looking at a screen like this is typically what you have to enter for the patient before you get started. So the patient's last name, first name, medical record number. Every ultrasound that we do has its own accession number, date of birth. That big box here is indication. So like reasons why you're doing the ultrasound, the user. So here you would put your initials, the reading doctor, the referring doctor. So this is a little bit time consuming. This can be a little time consuming for you to have to enter all this information. They did mention this something called work list. So some machines have this like work list option, and you click on the work list and it brings up like an entire basically like everybody who's being scanned or who's there to be scanned. And so you just like ask the patient their first and last name and date of birth, and then you find on the work list, like, so there might be like 15 different names, and you click on your patient. And then like, once you click on your patient, everything is already filled in for you. So work list is always nice because it does save you a little bit of time as an ultrasound tech instead of you manually entering all of this information. Okay, on page 35 in the green, it talks about different buttons on your machine or different options and what they're used for. So here's a picture of different transducers. All of them look a little bit different. Aside from them looking a little bit different, you'll notice that there's numbers on these transducers. The numbers are what we call the frequency of the transducer. And so you want to know that frequency, it says better tissue resolution of superficial structures is attained with high frequency. So tissue resolution is like tissue accuracy. So if you want like accuracy in your image, you're going to choose that higher frequency transducer. So like here is an example of like using a 7.5, which is higher than a 3.5, right? So this would be my high frequency. And so you could see that the image is just like a little bit more crisp, more clean, more like detailed. And then it says lower frequencies are used for deeper structures. So that's just kind of like how it has to be with ultrasound, right? You guys know this from physics. It's like you can't have it both ways. You have to choose, like, are you interested in getting more depth like to image something that's deeper in the patient's body, or are you interested in imaging something more superficial and getting more resolution, more accuracy? And so you would use that low frequency sound for deeper penetration, high frequency sound for more detail with superficial structures. Depth is a button we use. It adjusts the image size. So here you have a picture, and it shows you like how, this would probably be like the middle picture would be like probably the most appropriate depth here. I can see the entire liver, I can see the diaphragm, I can see the hepatic veins. And then this would be when it's like really, really close. And this is when it's like too far away. So you guys know how depth works. Overall gain changes the brightness of the entire image. It could be your whole image will be dark or your whole image will be light. On the next page, TGC gain. This is your TGCs, and your TGCs are adjusted to make up for the effects of the darkening of the image, right? So, or like the attenuation of the beam. So here we have a big sized liver, and you can see how it gradually just gets really dark till it looks completely anechoic. And so this can be corrected by having this TGC curve. So sometimes we call it a TGC slope. And it's just like pushing your buttons towards the right, with increased depth. So you'll notice here they start more towards the left, but as the buttons go down, they go further and further towards the right. So that right deflection is what brightens your screen. The focal zone. So sometimes we use one focus, sometimes we use multiple, but that will be like, whatever piece of anatomy is at that focal point is the part that's going to be like the most clear. And here they're telling you the focus is too high. It is too high. And that's also like, you could see how like here the patient has something that focus should have probably been brought down to that level. Here's an example of dual screen. So sometimes, we use dual screen for different reasons. This bottom picture, they're using dual screen on the thyroid. So they matched, the right and the left isthmus or lobes with the isthmus there. So, this thyroid is too big to get on one screen. So like by using dual screen, they can get the entire thyroid. And then freeze frame and cine loop. Freeze frame and cine loop. So freezing is, probably like the first button that we ever figure out is freeze. But cine loop lets you kind of rewind the image to like a couple images back. If you liked your image, just like a couple seconds ago. Another thing I want you guys to know is image direction. So we don't talk about this a whole lot, but every single image will have like some sort of like icon or something here in the corner. And so this like should always be on this top corner. And that's when your image is like accurately positioned. If it's flipped, so if you see this icon here on this side, then like your entire image is reversed. And so this icon is a circle. Sometimes it's like a C, sometimes like it's an S, like for the GE machines, it's a G and an E. So, it can vary, but you want to make sure that it's like on the right part, or else your whole image is going to be kind of backwards. On page 37, these are measurement keys. So we have distance, we have trace or ellipse, and so just like the difference between them. So for example, here's a pyloric stenosis, and these are just regular calipers that are placed on different parts of the pylorus, and then the distance between the two calipers is measured. This is a pancreas, and you can see how they've like kind of outlined it. So if you were trying to measure the pancreas, because it's a curved structure, you would probably want to use trace. So trace is like where you get one caliper. So you would put that like one caliper in one area, and you would use your trackball, like roll your trackball all the way through. So you're in control of this to the end of the pancreas, the tail. And then this will measure, the distance when it's curved like that. And so that's nice because, when a structure is curved, calipers kind of don't do it justice. This is the fetal head. And this is an ellipse. So you can see how the little ellipse, the little dotted line is tracing the fetal head. And then we also have things like volume. So this is the bladder. And by placing the calipers in the right areas, it is going to calculate a bladder volume for you. So you can see here that the bladder volume of this patient is 236 milliliters. On page 38, other keys or additional controls that we use. So the first one would be body markers. So we don't use body markers a whole lot, but we do sometimes. So we always use a body marker when we're doing the breast. That's like kind of a standard in ultrasound. Everybody uses body markers when doing the breast. Um, Aside from that, whenever you're scanning something that may be like a little bit off, like your normal beaten path, right? So like something that's like a little, maybe outside of your protocol. Oh, the patient has like this funny little lump on the right side of their abdomen, or on the right side of the jaw or something. So you did your normal protocol, but now um, you're trying to image like that structure. Because you don't have a protocol for it, you want to use your body marker to show the doctor where you're at. So like you could see here, they use the body marker of the abdomen. And so those red lines indicate exactly where the transducer was placed. Aside from that, we also have like Doppler modes. So you guys know that there's color Doppler, power Doppler, continuous wave Doppler, pulse wave Doppler, and when and why they're used. M mode. So this like last picture here in the corner, this is an M mode, and this represents the active fetal heart here. The squiggly lines are an active trace. And then if it was like flat lines, so if it just kind of looked like this, like no squiggles, but just these like flat lines, that would be non-active, so like a non-active fetal heart. And so M mode is used. And then monitor controls. So monitor controls are controls that are actually on your screen that you're looking at on your monitor. And so they allow you to change the brightness and the contrast of your image. Okay, and then you want to go ahead and make sure you read the rest of the chapter, which talks about how to operate your ultrasound machine and then how to save and store. So on page 39, they talk about the PACS, which stands for Picture Archiving and Communication System. It says, which is based on computer technology. It allows for improved image resolution as images are stored in a digital format. So PACS is what stores your images. And so that's why, like 17 years later, if you ever want to go get like those images that you got an ultrasound once, you can go and they're able to pull up the images because they're all digital and they're all saved. And so it's easy to, you're not walking around with like pictures inside your wallet that are like going to fade and deteriorate over time. And so PACS is what allows you to do that. It also says in that area that the ability of PACS to interface with other computer systems within the hospital. So PACS also, it doesn't like confine you to just an ultrasound machine. PACS allows you to, see the baby on the screen. You can use a computer to see your images. The doctor can use their computer in their office to see the images. And so you don't have to be in one room. You can kind of be anywhere in the hospital and anybody can look at these pictures if they have access to PACS. So as you guys work through the chapter, go ahead and let me know if you guys have any questions. And I would be happy to help you. So have a good day.